Your cat crouches low, neck stretched forward, sides heaving, and nothing comes out. You watch, heart in your throat, wondering if this is just another hairball moment. You call your cat's name softly. No response. Just that low, desperate, wheezing pull for air. A sound you have never quite heard before, wet and labored and wrong. The kind of sound that roots you to the spot, and then just as suddenly as it started, it stops. Your cat stands up, shakes itself, and walks away like nothing happened. You exhale, you tell yourself it must have been a hairball, you go back to whatever you were doing, but something in the back of your mind won't let it go. Because deep down, you know that sound wasn't right, and you were correct to stay unsettled by it. That coughing, crouching, neck-stretching episode your cat just had may not be a hairball at all. Most owners make that assumption. It is the most common and the most costly mistake I see. Because if what you just witnessed was feline asthma, and it very well may have been, ignoring it means the damage to your cat's airways gets worse every single week you wait. But what if I told you that a lot of cats living with this condition go undiagnosed for months, sometimes years, because their owners genuinely cannot tell the difference between a hairball and a respiratory crisis? What if I told you that the noise your cat is making right now, the one that brought you to this video, is actually your cat's body sending you a signal you can learn to read? And once you can read it, you can act on it. That is exactly what this video is about. I'm James Pohl, your neighborhood veterinarian, and I'm so glad you came back to the channel today. After more than 40 years working with cats, I can tell you that feline asthma is one of the most under-recognized conditions I see come through a clinic. Not because it's rare, but because it looks so ordinary on the surface. A cat coughing in the corner, a quick bout of strange breathing, gone in 30 seconds. And so owners wait, and the airways silently stiffen. By the time the cat lands on my examination table, the changes on the chest radiograph are already telling a story that started months ago. I have dedicated my career to understanding the root cause of what makes animals sick, not just reaching for the first pharmaceutical tool in the drawer. And with feline asthma, the root cause conversation is one of the most important ones I have. This community has become something truly special, my friends. The fact that you are here watching a video like this, asking the right questions about a sound your cat made, that tells me everything about the kind of pet parent you are. If you watched my recent video on decoding your cat's breathing patterns, some of what we covered today is going to slot together beautifully for you. Go find that one after this. Today, I want to give you a complete masterclass on feline asthma. We are going to cover what it actually is at the biological level, why some cats develop it and others don't, how to tell the difference between asthma and a hairball, what triggers it in your home right now, what a proper diagnosis looks like, and what you can do today to help your cat breathe easier. Grab something to write with. There is a lot here that matters. And if you have not subscribed yet, please do it now before we dive in so you never miss one of these. Chapter 1. What is actually happening inside your cat's airways? To understand feline asthma, you have to picture the inside of your cat's lungs at the microscopic level. Think of the airways, the bronchi and bronchioles, as a branching tree of tubes that carry air down into the lung tissue. In a healthy cat, those tubes are open, flexible, and lined with a thin, smooth layer of mucus that keeps the tissue moist and helps trap particles. Air flows in easily, the lungs expand, oxygen crosses into the bloodstream, carbon dioxide comes back out. Clean, efficient, effortless. Now picture what happens when the immune system overreacts to something it has decided is a threat. The walls of those bronchial tubes become inflamed. They swell inward, narrowing the passage. The mucus-producing cells go into overdrive, flooding the tube with thick secretions. The smooth muscle wrapped around the outside of each tube tightens in a spasm, squeezing the passage even smaller. Your cat is now trying to push air through a tube that might be half the diameter it should be, or less. That is an asthmatic episode. The body trying to expel an imagined invader by constricting the very passage the cat needs to breathe. And here is the part that makes feline asthma so serious over time. Every time that inflammatory response fires, it leaves a little scar tissue behind. Chronic inflammation causes structural changes, a process called airway remodeling, where the bronchial walls thicken permanently. The more episodes go untreated, the less elastic and open those airways become. The cat that looked fine between coughing fits is quietly losing respiratory capacity. If you look at a chest radiograph of a cat with advanced chronic asthma, the lungs that should appear largely dark with air appear patchy and white. There is simply less functional lung left. That is why the timeline of diagnosis matters so much. The earlier this condition is caught, the more of that airway architecture can be preserved. There is also a critical immune mechanism here worth naming, because I want you to understand why this is not just the flu or a passing irritation. Feline asthma involves a hypersensitivity response driven largely by a type of white blood cell called the eosinophil. When an asthmatic cat encounters a trigger, the immune system floods the bronchial lining with eosinophils, which release inflammatory compounds in an attempt to neutralize the perceived threat. Those compounds cause the swelling, the mucus, and the muscle spasm all at once. It is an immune system doing exactly what it was designed to do, just dramatically miscalibrated. Chapter 2: Why your cat developed asthma and what is triggering it in your home right now. Feline asthma is not bad luck. It is not random. It is an allergic, immune-mediated condition, which means something in your cat's environment is repeatedly provoking that hypersensitive response. The great majority of asthmatic cats are reacting to inhaled environmental allergens. And here is what makes this both frustrating and empowering at the same time. The trigger is often something sitting right inside your home. Let me take you through the most common culprits I have identified in my years of practice. Cigarette smoke is the single most damaging inhaled irritant a cat can be exposed to. The particulate matter and the volatile organic compounds in cigarette smoke settle into a cat's airways with every breath. A cat living in a smoking household breathes at the same height as the smoke that drifts down from a lit cigarette or settles onto furniture. If your cat coughs and there is smoking happening in your home, that is not a coincidence. Plug-in air fresheners and aerosol sprays are, without question, one of the top causes of feline bronchitis and asthma that I see in clinic. This one surprises owners every single time. The molecules in those products are incredibly fine. They stay suspended in the air for hours. Your cat breathes them in over and over throughout the day. The same applies to incense, scented candles, fabric sprays, and perfumes applied near the cat. I have seen cats improve dramatically within 2 weeks simply by removing every scented plug-in from the home. That is not a small thing. Household dust and dust mites are another enormous factor. If your cat sleeps on carpeted surfaces, on soft furniture, or on bedding that isn't washed regularly in hot water, the dust mite load in their environment is almost certainly high. Dust mites produce a protein in their waste matter that is one of the most potent asthma triggers known in both cats and humans. Washing your cat's bedding in water no cooler than 60 degrees Celsius, about 140 degrees Fahrenheit, every 10 to 14 days makes a measurable difference. Certain cat litters release fine mineral dust with every scratch and every step your cat takes through the tray. Clay-based litters are the worst offenders. If your cat uses a covered litter box and the litter is dusty, your cat is essentially breathing in a small dust storm inside an enclosed space every time it uses the tray. Switching to a low dust or dust-free litter is one of the simplest, most immediate environmental changes you can make. Pollen is seasonal but real. Cats that have access to the outdoors or live near open windows during high pollen months can experience flare-ups that track with pollen counts. If your cat's coughing gets worse in spring and summer and improves in winter, pollen should be on your list. Certain cleaning products, particularly those containing strong bleach concentrations or pine-based disinfectants, leave residue on floors. Cats groom themselves constantly. Whatever is on the floor ends up inside your cat. If you are cleaning your cat's environment with harsh chemicals, you need to know that. And one final trigger that owners rarely suspect. Some popular cleaning products marketed specifically as pet safe still contain compounds that are bronchial irritants in cats. Just because the label shows a cat does not mean it is safe for a cat with sensitive airways. When in doubt, plain water and white vinegar is your safest surface cleaner. I want you to walk through your home today and ask yourself which of these are present. Removing even one major trigger can reduce your cat's symptom frequency significantly. Chapter 3, the most important thing, this video. How to tell asthma from a hairball. Stay with me here, because this next part is the one that could genuinely save your cat's life. This is where I need your full attention, because this confusion is responsible for months of delayed diagnoses. And I understand it completely. The two events look remarkably similar at a glance. When a cat is trying to bring up a hairball, the body's action is primarily digestive. The cat will often stand or crouch slightly, but the movement is abdominal, rhythmic, and retching in quality. It looks like nausea. The cat is pushing from the stomach upward. There is often a visible heave of the belly. And if a hairball is coming, something eventually appears. Either the compressed tube of hair and digestive fluid that is the actual hairball, or some bile or foam if the attempt wasn't successful. The sound tends to be wetter, more of a gagging quality, and the event usually resolves in under a minute with that physical outcome. An asthmatic episode looks and sounds fundamentally different. The cat crouches much lower to the ground, almost as if it is trying to make itself flat. The neck stretches forward and downward. This is not a random posture. Your cat is trying to straighten and open the airway by extending its neck, instinctively creating the least restricted path for air. The sound is a harsh, dry, repetitive cough or wheeze, not a wet gag. The belly pulls in sharply with each attempt, but there is no retching quality. Nothing comes up. Because the problem is not in the stomach. The problem is in the bronchial tubes. And when the episode passes, the cat straightens up and walks away because the spasm eased, not because anything was expelled. That posture is the signal. That low crouch with the extended neck. Once you see it in the context of an asthmatic episode, you will never confuse it with a hairball again. I want to be very direct with you here, my friends. If your cat has been having these crouching, dry coughing, neck stretching episodes, and you have been putting hairball remedy on their paw and hoping for the best, please stop. That cat needs a respiratory assessment, not a laxative. Chapter 4, what a real diagnosis involves and why it matters. Now, I want to be equally direct about something else. Feline asthma cannot be diagnosed at home. I know this channel is about empowering you, and I am going to give you every tool I can. But the diagnosis of asthma requires a veterinarian. Here is why. The symptoms of feline asthma overlap with several other serious conditions. Heartworm disease causes respiratory signs in cats. Cardiac disease, fluid around the heart or lungs, bacterial bronchitis, lungworm infection, and even thoracic masses can all produce coughing and labored breathing. If you walk into a clinic and say your cat is coughing and a vet puts a medication in your cat's mouth without ruling these things out, that is not good medicine. A proper diagnostic workup begins with a thorough physical examination with particular attention to auscultation. Your vet will press a stethoscope to various points on your cat's chest and listen. In an asthmatic cat, you may hear wheezing, which is a high-pitched sound caused by air being forced through narrowed tubes. You may hear crackles or increased bronchovesicular sounds. In a normal cat, the lungs are quiet, smooth, and clear. A chest radiograph is essential. In a cat with feline asthma, the classic radiographic pattern includes what's called a bronchial pattern, where the walls of the bronchi appear thickened and more visible than normal, giving a classic donut and tram track appearance on certain views. In more advanced disease, hyperinflation of the lungs can occur because air gets trapped behind the constricted airways. The lungs look larger than they should, and the diaphragm may appear flattened. In chronic cases, patches of collapsed lung tissue called atelectasis appear as solid white areas. A blood count often shows elevated eosinophils, those immune cells I described earlier, which supports the diagnosis. In some cases, a bronchoalveolar lavage may be recommended. This is a procedure where a small amount of sterile saline is flushed into the lower airway and recovered for analysis. The cellular composition of that fluid tells us what kind of inflammation is present. A predominance of eosinophils in that sample is one of the strongest confirmations of allergic airway disease. The reason all of this matters is that the treatment plan differs significantly depending on what else is or is not present. A cat with heartworm-associated respiratory disease does not need the same treatment as a cat with classic allergic asthma. Getting the diagnosis right from the beginning is what puts your cat on the correct path. Chapter 5. What you can do at home to support your asthmatic cat. Let's talk about what you can actually do, because there is genuinely quite a lot. The single most impactful thing you can do is a systematic trigger audit. Go through your home, room by room, with the list from Chapter 2 in your mind. Write down every potential irritant, then eliminate them one by one, starting with the most potent, which means cigarette smoke first, then scented plugins and aerosols, then litter type. Give each change at least 2 weeks before assessing the effect. Do not change everything at the same time, because if your cat improves, you won't know what helped. If your cat worsens, you won't know what caused it. Switch to a premium low-dust cat litter. There are several on the market made from compressed paper, wood pellets, or silica crystals that release almost no airborne particles. The transition may take a week or two for your cat to accept, but it is worth the patience. If your cat has a covered litter box, consider removing the cover temporarily during the trigger reduction phase. I know that feels counterintuitive for odor reasons, but a covered box concentrates the dust your cat breathes in every single visit. Improve indoor air quality. A high-efficiency particulate air filter, commonly called a HEPA filter, placed in the room where your cat sleeps most, can meaningfully reduce the burden of airborne allergens, including dust mite proteins and pollen particles. Run it continuously. This is one of the most underused tools in environmental asthma management for cats. Wash all fabric surfaces your cat contacts regularly. Your cat's bedding, blankets, and the covers of soft furniture should go through a hot wash cycle every 10 to 14 days. That heat cycle breaks down the proteins from dust mites that trigger the immune response. Keep your home well ventilated but filtered. During high pollen months, keep windows closed when pollen counts are high and rely on your indoor filtration. During low pollen periods, fresh air circulation is beneficial. Manage your cat's weight. Overweight cats have more labor breathing at baseline and less respiratory reserve during a flare. If your cat is carrying extra weight, working with your vet to bring it down will improve respiratory function. Reduce stress. This may sound indirect, but physiological stress activates inflammatory pathways. A cat living in a chronically stressful environment, whether due to inter-cat tension, noise, or unpredictability, will have a lower threshold for asthmatic flares. Providing predictable routines, safe elevated resting spaces, and calm handling makes a measurable difference. Chapter 6. Medications and when they are necessary. I want to address this chapter honestly, because I know my community values the natural and the holistic approach, and I share that philosophy deeply. But I also have to be honest with you about the limits of environmental management alone. For a mild asthmatic cat with infrequent episodes, environmental control and trigger removal may be enough to keep the condition well managed. I have seen cats whose coughing essentially stopped after the household removed its plug-in air fresheners and switched litter. That is real. That is not small. But for cats with moderate to severe disease, with frequent episodes, progressive airway changes, or episodes that include open mouth breathing, your veterinarian will almost certainly recommend medical management. The two main drug classes used are bronchodilators, which relax the smooth muscle around the airways and open them up quickly, and corticosteroids, which reduce the underlying inflammatory process. The gold standard for delivery of both of these in cats is inhalation. A metered dose inhaler paired with a cat-specific spacer device allows the medication to be delivered directly to the bronchial tissue at very low doses, reducing the systemic side effects that come with oral or injectable steroids. This approach has transformed the long-term management of feline asthma. A cat that once needed high-dose oral steroids to function can, with proper inhalation technique, be maintained on a fraction of that dose delivered right where it is needed. Your vet will guide you on which medications, which doses, and which delivery method is right for your cat. Please do not add or adjust medications without veterinary guidance, because dosing errors with corticosteroids in cats have serious consequences. The honest message is this: holistic support and medical management are not opposites. The best outcomes I have seen in asthmatic cats come from owners who do everything on both sides. They eliminate the triggers, they maintain the environment, and they follow the medical protocol with consistency. The biggest mistake owners make. I see this pattern more than any other. An owner brings in a cat that has been coughing for 3 months. I ask when it started, they tell me. I ask what they did when they first noticed it. They say they watched and waited because they thought it was hairballs. Then they tried a natural remedy they saw online. Then they noticed it was getting worse and finally came in. By the time I see that cat, the chest radiograph is already showing early chronic changes. Waiting is the mistake. Not because you are bad at this, you are watching this video, which means you are trying. But the architecture of your cat's airways is not waiting. Every inflammatory episode that goes unaddressed deposits a little more fibrous tissue, a little more permanent narrowing. The window in which you can prevent chronic airway damage is measured in weeks and months, not years. The second mistake is not connecting the trigger to the symptom. An owner will tell me the cat started coughing in November. I ask if anything changed in November. After a few questions, they remember. They got a new plug-in air freshener for the holidays. That is the cause. That is not a coincidence. The third mistake is inconsistent treatment. For cats on inhaled medication, the inhalers need to be used exactly as prescribed, even when the cat seems fine. Asthma is a chronic inflammatory condition. The inflammation does not disappear between episodes. It just quiets down. Stopping treatment when symptoms ease is how you end up back in the crisis. The golden rule for managing your asthmatic cat at home. If you feel overwhelmed by everything in this video, here is what I want you to take away and act on first. Pick 2 things from the environmental changes list and implement them this week. Not everything at once. 2 things. Start with the highest impact ones. If there is smoking in your home, that is the first one. If you use scented plugins, that is the second one. If neither of those applies, then your cat's litter type is your first change and your cat's bedding washing schedule is your second. Book a veterinary appointment, not next month, this week. Describe the crouching, the neck extension, the dry repetitive cough, and the duration. Use those words. They will help your vet know exactly where to start. And keep a symptom diary. Write down every episode you witness. Note the time of day, the duration, what your cat was doing before it started, whether any sprays or cleaning products were used recently, and how quickly it resolved. That diary is clinical gold. It will help your vet identify a pattern that could point directly to the trigger, when to go straight to the emergency clinic without waiting. If your cat is breathing with its mouth open and nothing is blocking the airway, that is an emergency. If your cat's gums or tongue look blue or gray rather than pink, that is an emergency. If your cat is in visible distress and cannot settle or is panting rapidly, that is an emergency. If an episode of coughing does not resolve within a few minutes and your cat is showing signs of panic or extreme fatigue, that is an emergency. These are signs that your cat is not getting enough oxygen. This is not a situation for a home remedy. This is a situation for the nearest veterinary emergency clinic right now. In between those red line moments, feline asthma is manageable. Many cats live full, comfortable lives with it. But management requires accurate diagnosis, consistent environmental control, and appropriate medical support. All 3 together. Not one of the 3. My friends, if you are sitting with your cat right now, remembering that sound, feeling relieved that you finally have some clarity, and maybe also a little scared about what comes next, I want you to hear me on this. You did the right thing by seeking this information. The fact that you heard a sound and instead of simply dismissing it, you asked why, that is not something every pet owner does. That careful attention, that instinct to understand rather than ignore, is what makes the difference between a cat whose asthma is managed early and one who comes to me years into the disease. You are not overreacting by taking this seriously. You are being exactly the kind of guardian your cat needs. If this video helped you, please hit the like button. When you do that, you are telling the algorithm that this kind of careful, honest veterinary content deserves to reach more families, and it does. More views means more cats getting diagnosed sooner. Subscribe if you haven't yet, and share this with anyone you know who has a cat that coughs. That share could genuinely change an outcome for someone's pet. And I have a question for you in the comments. Tell me what sound or behavior your cat makes that first made you worry. Describe it as specifically as you can. Were they crouching low with the neck extended, or does it look more like a gag or retch? Your answer might help someone else in the community identify what they are seeing in their own cat. This conversation matters. Give your sweet cat a slow blink and a gentle scratch behind the ears from me tonight. Stay safe and always trust your instincts when your animal tells you something is wrong.